days. And so this, of course, makes our ability to keep up with this virus very difficult, given how quickly it's transmitted and given how quickly we're trying to notify people of their positive test results and quickly get in touch with people they may have exposed. So for now, we're really urging individuals to only seek testing if they have symptoms or if they've been directed to because they're a very close contact to a confirmed case. We're also really urging employers not to require documentation of a negative test for any kind of return to work. Healthcare does not use that requirement. It is not a good way to protect your business from COVID-19. I should say there are better ways to protect your business from COVID-19. And for now, just thinking collectively, it's not the best use of our testing resource. So we're trying to get that message out. Contact tracing is challenging with the increase in cases. Again, we've had to ramp up our contact tracing teams quickly. So we've had to respond and train and hire more contact tracers as we've gone. Because the spread of the virus is accelerating, we are working very hard and struggling, frankly, to keep up with the number of cases, but we are doing our absolute best. The turnaround times has created a problem. Testing capacity has created a challenge. What we are seeing is more household contacts, more social contacts, extended family. And I'm sorry to say that we're actually starting to reach individuals who are less inclined to work with us and businesses. I'm also hearing anecdotally of some businesses really not wanting to cooperate with public health. So it's a very challenging time right now. Finally, in terms of disease patterns, there's really no single group or activity to blame. We have seen a shift to younger people. We know people in their 20s and 30s now are most likely to test positive for the virus and get sick. Of course, those are not all mild cases. We've now had 3 people in the 30s age range die of this virus in Multnomah County. So as my medical colleagues say, it is a roll of the dice for younger people. We're also continuing to see a disproportionate impact on our Latinx population and Pacific Islanders. And we think that has very much to do with the fact that they work in essential jobs. They tend to live in more crowded households and have more extensive social connections. So that's basically a rundown of where I think we are. This is an uncertain time. Again, just in terms of where we are in the overall narrative, the goal was for everyone to stay home, which they did, to great success. The hope was to really push down the level of virus in our community to a low enough point that we could manage it through expanded testing and contact tracing. What we're seeing now is that people eager to socialize with extended family and friends have done that and have actually accelerated virus spread just at a time when our national supply chain for testing is strained. And we're struggling with turnaround times and even, unfortunately, with people particularly wanting to work with us. So again, we're heading into uncertain times as far as the tools that we have to control this virus. What we do know works is people limiting their social contacts. If you are going to have social contact, do it outside, maintain 6 feet of distance, use a face covering, and really just limit the number of people that you are having contact with. So again, that's really our big ask here. We are doing what we can around this virus, and we have to emphasize that it really comes down to individual behaviors daily that people choose as far as how they socialize, who they socialize with, and how much and how close, that is ultimately going to decide what the next few weeks and months look like. So that's what I had prepared, and now I'm happy to open it up to questions.
Yeah, thank you so much, Dr. Vines. And I just wanted to clarify one thing. You mentioned 3 people who in their 30s who have succumbed. Did you mean in the state? I'm
sorry. I'm sorry. I said Multnomah County. I should have said statewide. Excuse me. That is statewide.
Thank you so much. And so for folks who are joining us, please do unmute yourself, ask your own questions. If anybody, and I don't think anybody is, but anybody on the phone can just dial *6 to unmute and mute yourselves. And then if anybody, it seems like some folks might have had trouble logging on. So if anybody did, just flag me at the end of this. I am recording this so I can share that with you too if you missed a bit. And other than that, I will, Lachey, I'm gonna unvideo you. Sorry, but you're totally welcome to ask a question. Please do feel free to unmute yourself and ask your questions. And there you go, open it up.
I've unmuted already. Tim Gordon at KGW. So Dr. Bynes, I guess I'll go first. You answered a couple of our questions already, so thank you for that. But can you answer what's the rate of positive test results in younger people? Do you have that, Andy?
I think you're referring to percent positive.
Yes.
I'm not sure we have it by age group. We have overall, I would have to double check and get back to you about whether we have it for age group.
Okay, that's one. Let me go ahead and ask another then, if I may. Do you see any correlation between unmasked protesters and community spread?
So the question around have we seen cases related to unmasked protesters, and I'll just broaden the question to protests in general. We have not. We've looked and we cannot find an association there. And when I say we've looked, we ask people about any kind of gathering, any mass gathering in the time that they were potentially infectious. We have invited anybody who participated in the protests to our Multnomah County testing site, and we have yet to detect a contribution, a meaningful contribution of the protest activity to our increase in cases.
Thank you.
Hi, this is Amelia Templeton with OPB. Does Multnomah County have its own capacity to process test results? And if so, who are you prioritizing?
Mm-hmm. So Multnomah County we have a couple different activities. Our primary care clinics use Quest labs. And so they are working to prioritize their patients that they test along public health guidance, which is symptomatic and close contacts of confirmed cases as the top tiers. Our testing site is largely sponsored by public health. We are also struggling with turnaround times and looking literally today to get lab capacity through a different lab with a 24-hour turnaround. So right now, I think everybody is struggling with turnaround times at Multnomah County.
And I've heard, so Quest, is that through the state's contract with Quest that Multnomah County has been?
That I would have to check with you. That's our primary care clinic system, and I would have to check with them exactly how they have that set up.
And do you know on average how long it's taking to get results from Quest?
I'm hearing several days to a week and sometimes longer.
And I'm noting these questions too, Amelia. I think we might have a little bit more on that, and I'll just follow up. I'll follow up with you all after this.
Is it feasible to do contact tracing with that kind of testing timeline? Does it actually prevent the spread of COVID given how much time it takes?
That's a great question. And with a virus that moves as quickly as COVID, a lab turnaround of several days, by the time the lab gets resulted, it gets into the hands of one of our Multnomah County contact tracers and they get a hold of that person. By then, several days have gone by. There's a big prevention window opportunity missed. So to answer your question more directly, it makes contact tracing much more difficult and much less effective.
Yeah, Jennifer, this is Wayne Haverly at Coin TV. Since we're on the topic of contact tracing, and we've been hitting, record highs several days over the last week or so, as you've looked back, how much of this is related to what occurred over the 4th of July holiday when people were gathering in great numbers?
So I don't have an exact accounting of 4th of July activities. I think in general, what the state has said, and we're seeing the same thing, it's people gathering for weddings, fraternity parties, bachelor parties, friends getting an Airbnb together. It's people mixing with their close family and social contacts, probably letting down their guard in terms of distancing and masking and other precautions that may not feel natural to do around people that you know well and consider loved ones. So I would say, again, I can't quantify impact of 4th of July per se, but in general, I think following the stay-at-home order, people have been so eager to reconnect with friends and family, in addition to returning to work and putting their kids in childcare and traveling, that we're seeing the kind of social mixing that fuels the spread of this virus, which we know goes easily from person to person.
And of course, we've seen rollbacks in many states already. And with this growth that we're seeing now, how close do you think we are now to maybe having recommendations to start rolling back like some other states have done?
Again, the rollback question that's not my decision to make. I'm not hearing rollback per se in the conversations that I am in. I do know that everyone in public health, local and state, is paying very close attention to the numbers. We're clearly headed the wrong way. And I think we'll be having some very active discussions this week on what may be a next step in terms of trying to use a public health and a policy tool to slow the spread of this virus. Again, it really comes down to individual behaviors.
Dr. Vines, what would be your recommendation if you were to talk to the governor right now based off what Multnomah County is dealing with?
Yeah, I think the governor has a great team. She has a team of advisors. I think she's looking for input. So a lot of us have been brainstorming here in the metro area. I know that the state is actively looking at this. There's some rural counties, I think probably similarly looking at their particular situation and setting. We're doing a scan of what other jurisdictions have done that may be effective. We're really trying to dig into our data to see if there's information there that could point to a potential policy solution. So I don't have a list for you right at this moment, but in terms of what works is trying to get people outside rather than inside, really trying to get workers protected because of the outbreaks that we've seen at work sites. And then just really getting people on board with just routinely wearing a face covering in any indoor setting.
With those businesses that you have seen workplace outbreaks, have they been businesses that have just been allowed to open, or were they businesses that were allowed to? Can you give us kind of an idea of what businesses are being impacted?
Mm-hmm. So I scanned our list of outbreaks before this call, and it's all over the map. So food processing has been in the news certainly, but it's just been all over.
Dr. Vines, you said that contact tracers are encountering people who don't want to, speak with them. Can you elaborate a little bit and maybe give us some specific anecdotes or sense of the experience that the contact tracers are having? Thank you.
Mm-hmm. I can probably get to a better anecdote. I know some people are very hesitant to share friends and family's information directly with us. So for anybody who's concerned that that it's not really public health calling, we have ways of, having them call us back to prove that it is the local public health department reaching them, for example. But I think in an age where there's this balance around privacy, not everybody is willing to share full information and full list of contacts with us. But I can try to get you more anecdotal details.
Dr. Vines, can you hear me? Do you have any idea how many cases have come from indoor versus outdoor? Any sense of that?
I don't, and I hesitate to say we could get that for you because I'm not sure we collect the data at that level to parse out exposure. But if we have it, we can try to get it.
Dr. Vines, hi, it's Amelia again.
Mm-hmm.
Is there any change in Multnomah County in, I guess, given the testing issues and the turnaround time and the fact that that's kind of a supply and demand issue, is there any change in who's being prioritized for testing or who the county is recommending does or does not get tested? Mm-hmm.
So I actually sent out a clinician alert. It goes to an email list of clinicians who have opted in to get public health alerts through their licensing board. And I really boiled it down to two categories. And one is people with symptoms. And we know certainly that people with this virus don't always have symptoms. In fact, many people walk around with the virus without symptoms. But we think that if you have a runny nose, if you're coughing and sneezing, chances are you're likely to be more infectious. And chances are we're more likely to pick up the virus in people who are actually experiencing illness. We're also recommending testing of people who have had close contact with a confirmed case, again, because we know it spreads easily in households and through close social contact. If we can do that quickly enough, we can identify sort of the next round of cases and the next round of contacts to try to keep up with the virus. So we've been clear about those two groups. That's not to say that there are people who want testing, and in a perfect world, I wish I could say anybody who wants to be tested can be tested, but that is simply not the circumstance we are in right now. So we are deprioritizing people who are worried and just want to know. Unfortunately, some states are requiring a negative result for travel. So I think those individuals are getting deprioritized. And as far as work,
Alaska, right?
Alaska and Hawaii are two that I'm aware of.
Mm-hmm.
And that's in order to avoid quarantine, I believe, on arrival. I will just call out an exception, and that's workers who work in long-term care facilities do need to be tested. That is where it is important to have negative test results prior to return to work because of the risk in those facilities. But pretty much anybody else, including healthcare, including hospitals, just requiring a negative test in someone who is well for their return to work is, again, it's not good use of our testing resources, and it's not the best way at this point to keep COVID out of your workplace.
Just one follow-up. The Multnomah County had been encouraging people of color to be tested if they were concerned because of the much higher incidence of COVID among some particular communities. So if you are an asymptomatic person who is a Pacific Islander or Latinx, what's the access to testing like now for those groups of people if they're not a close contact or symptomatic?
Mm-hmm. So within the symptomatic and close contact categories, we're prioritizing the Black, Indigenous, people of color, Latinx, and that's specifically what our East County testing site is targeted towards. So it's really with a focus on those communities through outreach and through communities that we know are at risk. I believe, unless we're completely out of room, we don't turn anyone away who comes to that testing site, in particular if they are one of our priority communities.
Dr. Vines, could you remind me what you said about what Public Health Lab is doing, changing to be more efficient and get tests done more quickly, turned around? But before you do that, can you also, given a 20% drop in federal delivery of what you need to do your job, what's your message to federal officials responsible for that?
So I'll touch on your first question, which was a clarification around the Multnomah County, the East County testing site, which is meant to be a low barrier, again, focused on communities of color and those suffering disproportionately from this virus, just to have easy access to testing. We are actively looking into changing to a lab platform with a turnaround time of 24 hours rather than what we have been using, where we are also seeing essentially unworkable delays. So I don't have any more to say than that, except that we're working on it. I think my message at the federal level is that we at the local level are doing the best we can with what we have. I think the more support and coordination we have at the national level, the better off we are all going to be, because clearly this virus is going to continue to rear its head in different states, in different places at different times. And I think the more we can align our responses across the country, I think the better off we'll all be in terms of resources and in terms of really trying to get a handle on the spread of this virus.
How would you characterize that support and coordination right now?
The Centers for Disease Control remains the North Star to a large extent of much of our public health work. It informs our guidelines, it informs our advice. I would say at this moment, if there is a specific national strategy that is forward-looking, I am not aware of it.
Thank you.
We have a couple more minutes. If anybody else has a question or two, we can take a couple more.
Hi, Haley at KPTV. I had a question just about hot weather and masks. I know over the weekend we saw a lot of people on the river in those kind of situations not wearing them. Would you recommend for people to wear them even if they're kind of out on the water?
So the recommendations for masking outsider is you should be wearing one if you can't reliably maintain 6 feet of distance from other people. So if you're in a place where you know you can spread out and you're paying attention to your distancing from other people, then you don't have to wear a mask. If you're at a crowded outdoor site, you will want to have a mask handy that you can tolerate in the warmer weather.
Long pause, I'm going to ask one more. Is it too soon to know yet, or what can you say about the lasting health impacts of those who survive this virus?
I'm sorry, I didn't make out the second half of your question.
Sure. Wondering about the lasting or long-term health impacts of COVID-19, the lasting or long-term health impacts of
lasting
of
or long-term health impacts. Sure. So that picture is just starting to emerge as more and more people recover sort of across different age groups and with different underlying medical conditions in play. So we are starting to see reports of people with symptoms several weeks out of their official recovery. And I think that medical picture and science is going to emerge in the coming weeks as, for better or worse, we have more people surviving this virus, recovering from it, and we start to truly understand what are the long-term implications across the lifespan. So I think more to come there.
Hi, can you hear me? It's Aimee Green at the Oregonian.
Mm-hmm.
Okay, I apologize. I was just able to join now, and maybe someone hasn't already asked you this question. The governor has said that people shouldn't gather indoors in groups of 10 or more. I'm wondering if you have thoughts about, when I look around my neighborhood, there's people gathering in smaller groups. They're having visitors over, maybe, you know, a family, one family here, one family there. Is that a concern of yours?
I think, yeah, there is no sort of magic safe recipe. So indoor versus outdoor matters, with outdoors being safer. Fewer people is better than more people. You want to, in terms of the people that you are interacting with, you don't want those to be people you have not interacted with recently. So you want to, people talk about making their bubbles. So kind of stabilizing your particular social group, as opposed to, for example, having several small gatherings, reconnecting with people from all over the city or elsewhere. And then finally, always the 6 foot distancing and the face covering as the backstop. And then I feel like I don't need to say this anymore, but I will say it. And, you know, anyone who's feeling poorly really should not be socializing at all. So none of the physical distancing or face covering is a substitute for just simply staying home and staying away from other people if you're feeling poorly, regardless of whether you pursue viral testing.
So would you say if someone has a bubble, like they really should just have one other group in their bubble?
The smaller your bubble and the more sort of committed your bubble is to only essential outings, face coverings, really paying close attention to those distancing and, you know, hand hygiene components, the safer in general, the safer you're going to be. I say that, and there are no guarantees. Again, this virus spreads really easily, but that is about as low risk as you can get.